My name is Kristen Farino, Austria, and I'm a nurse practitioner at Urology of Virginia. I specialize in treating overactive bladder and incontinence issues. Overactive bladder is not a disease. It's the name for a group of urinary symptoms. The most common symptom is a sudden, uncontrolled urge to urinate. Some people will leak urine when they feel this urge. Another symptom is urinary frequency, both during the day and at night. Some of the symptoms you may have when you have overactive bladder include urinary urgency, urinary frequency, nocturia or getting up during the night to urinate, urinary incontinence, including having to use pads or depends. Some potential causes of overactive bladder include diet, age, stress, uncontrolled diabetes, dysfunctional voiding, neurogenic conditions including MS and Parkinson's. The workup for overactive bladder may include urinalysis to rule out infection as a source of the symptoms, avoiding diarrhea to monitor intake and output, cystoscopy, and urodynamics. Urodynamics is a study that tells us the function of the bladder and can better determine third-line therapies for overactive bladder. Treatment of overactive bladder is very pathway-driven. We start with conservative treatments and move towards medications and advanced treatments if warranted. Initial treatment of OAB includes diet modification, like limiting coffee, soda, tea, spicy and acidic foods, bladder retraining, which is urinating every 2 to 3 hours, not holding too long or not going every time you get the urge, and limiting fluids 1 to 2 hours prior to bedtime. If conservative treatments fail, then medications are discussed. There are 2 drug classes of medications for OAB, anticholinergics and beta-3 agonist. Side effects vary, and often insurance coverage will dictate which medications can be trialed. When both first and second-line therapies for OAB do not improve the patient's quality of life, we move through the OAB pathway, and oftentimes a urodynamic study is ordered. This diagnostic test evaluates bladder function and capacity. It better assists providers to determine which of the third-line therapies are most appropriate for the patient. Third-line therapies include bladder Botox, sacral neuromodulation or InterStim, and PTNS or posteotibial nerve stimulation. Botox is a procedure that can be completed in office or outpatient through a cystoscopy. Botox for the bladder lasts about 4 to 9 months. InterStim is a device that can treat both bladder and bowel symptoms. It is completed in a staged procedure. In the first procedure, temporary leads are placed to see if the device is going to be beneficial for the patient. If beneficial during this trial, then the permanent device is placed in the lower back. The battery lasts 5 to 15 plus years, and it's now MRI compatible. Posteotibial nerve stimulation, or PTNS, is another less invasive option for some patients. This procedure involves a small needle that is placed near the ankle and connected to a device. These treatments are completed weekly for 12 weeks and then monthly if successful. OAB is a diagnosis that many suffer from, and it can greatly affect quality of life. I'm dedicated to finding the right treatment for each of my patients so they are able to live free from urinary concerns. If you suffer from any of these symptoms or you think you may have overactive bladder, I encourage you to reach out to your primary care doctor for a referral to be treated at Urology of Virginia.